and welcome to our e-seminar. I'm Suzanne Noel, and I'm representing the clinical team here at NATIS, and I'll be moderating today's session. On behalf of the Neonatal Care Academy and NATIS Medical Incorporated, thank you for participating in our e-seminar entitled Best Practice for aEEG Electrode Placement. I'm very pleased to introduce our presenter today, Judy Moore. Judy is a dedicated and experienced advanced neonatal nurse practitioner responsible for providing clinical education and product support for NATIS Medical in her role as Senior International Clinical Education Manager. Her work involves developing web-based education programs for all aspects of newborn care, with courses covering subjects including aEEG application, hyperbilirubinemia, newborn hearing screening, and family-centered care. She also delivers advanced clinical workshop seminars at NATIS customer events and speaks at international conferences on neonatal issues with a special passion and interest in aEEG and the neonatal brain. Judy has a wealth of experience in teaching and supporting the application aEEG in the NICU, and has provided many workshops internationally on the subject. I'll now turn the meeting over to you, Judy.
Thanks so much, Suzanne, for that very kind introduction. And welcome to everybody who's joined us today. It's great to see so many people online. As Suzanne said, we want this to be an interactive session. We will be doing some practical aspects clearly on camera. We're going to have some interactive polling questions just to get a feel for what people are doing today and what people's challenges are when we're talking about electrode application and management for aEEG. So we'll move ahead. Again, welcome to this e-seminar. We are clearly going to focus on the best practices for electrode placement and management. The purpose of the presentation today really is, like we've said, to review the best practices for the application of electrodes, and we will focus specifically with the Olympic Brains Monitor in some aspects of this. So what we'll do is we'll take a review of electrode options and special considerations when we're thinking about electrodes. We will talk about hydrogel electrodes, subdermal needle electrodes, EEG cup electrodes, and with each section we'll talk about positioning, preparing the skin, placing the electrodes, and also we will focus on the ground electrode and the importance of that. After that, we'll, again, once we've got the electrodes in place, talk about connecting electrodes to data acquisition boxes, starting recordings, and probably one of the most important things, troubleshooting. So what happens when we don't get good impedance? What happens when something actually doesn't go as we quite plan after we've applied our electrodes? So first of all, just a quick recap on the Olympic Brains Monitor. So we hopefully know the Olympic Brains Monitor. It's a touch screen panel PC device with a tilt mount to the roll stand, and on the roll stand a nice handle, basket accessory where you can keep your infant prep supplies, locking wheels to make it secure, height adjustment pedal so we can have it at the right height in the NICU for us. But what we're really going to focus on here is the data acquisition box. So the data acquisition box is exactly where we will plug our electrodes in after application, and it's very clearly defined with a graphical interface as to which electrode goes into which point of the data acquisition box. And then this is simply connected, it's integrated with a USB cable connected to any of the 4 USB ports that you find on the Olympic Brains Monitor. So let's have a look at the electrode options. These are really the options that we're going to talk about today. So again, the Olympic Brains Monitor, we can utilize any of these electrodes, hydrogels, needles, cup electrodes, or really any compatible electrode with a 1.5mm connection hub. The type of electrode we choose really is determined by you as clinicians, bedside nurses, based on the state of the baby, based on any local unit specific policies and protocols, and based on skin integrity and gestational age. So all of these things are things that we will consider when we choose the specific electrode for each individual baby. What we kind of also need to consider, we think about hydrogel electrodes. Hydrogel electrodes that generally remain effective for up to about 24 hours without need for intervention. But what we will focus on, and we'll talk through this, they do require quite assertive preparation, and you may need to rehydrate them during use. We expect the impedance to range anything between 5 and 15 kilo ohms with these, but I say we'll talk through a little bit more detail as we go through. The next option here we have is the low impedance needle electrodes. These are a 27 gauge needle. They're inserted subdermally. Again, we're going to show some video footage of this. We're going to do some very practical application as we move through. In terms of preparation for needles, these really require preparation similarly that you would do to a blood draw or an IV insertion. So you would clean the skin in a kind of aseptic manner. And with low impedance needles, because they're sitting underneath the skin, they're sitting subdermally, we expect the impedance to be really between 0 and 2 kilo ohms, so much better impedance value with the needles. People often ask the question, how long would you leave the needles in situ? And again, the answer would be, do consult with your local infection control policies and guidelines. But in general, people will leave needles, functioning needles, in place as long as you would leave an IV cannula in place, which generally might range between 3 and 7 days, dependent on what your local protocol is. The final option here is the EEG cup electrodes. Again, these can remain effective for several days. They also require preparation of the skin, but the difference with the cup electrodes is we use conductive paste, and we can reapply that during use if we need to. So again, we'll talk through all of the application points with that. So I'm going to launch the first polling question for you guys, and it's just to try to establish which kind of electrodes people are actually using today. So if you're aEEG monitoring today, which type of electrode are you currently using? And you can select as many of these that apply. So if you want to make your vote, let's see, so 40% of people have said that they're using hydrogel electrodes, 45% subdermal needles, 23% are using EEG, and there's a few people online today who are currently not using aEEG in the NICU. Well, hopefully by the end of today's session, and you realise how easy it is to manage the electrodes, this will entice you to the benefits of using aEEG in the NICU. Okay, so let's move forwards. And we talked a little bit about this, which type of electrode should we choose? And this, again, it is a clinical choice as to which type of electrode you're going to use for a particular baby. There's quite a few situations you really need to consider. And the anticipated length of monitoring could actually help you and assist in making that decision. Is this going to be a very short-term monitoring, or is it going to be long-term monitoring? So if it's very short-term monitoring that you're intending to do, a few hours, let's say up to 24 hours, then potentially hydrogel or cup electrodes are maybe your best consideration, because you can apply them for 24 hours, the impedance should be fine. But if you're going to monitor for more than 24 hours, then perhaps you do want to consider using low impedance needles, because the impedance will remain low for much longer and they require much less intervention. The other thing to consider is, you know, hydrogel and cup electrodes, I mentioned this, they do require more preparation and handling, because we really do have to clean that baby's skin before we're actually going to apply the electrodes. So if you have a baby who has a very high acuity, who really doesn't tolerate handling well, then again, you might want to consider using low impedance needle electrodes, because they really do result in less handling and less preparation. The other things to consider are the physiological considerations. So, you know, the one thing that we're always challenged with is hair. How much hair has the baby got? Have they got very excessive hair? Because sometimes it can be challenging to achieve acceptable impedance levels with the hydrogel and cup electrodes if we're not going to shave the baby's head, and we try to avoid that if at all possible. And if the baby is extremely preterm, and or if the baby's condition of their skin, if they've got very poor skin integrity, doesn't accommodate very assertive preparation, that also might influence your decision. So again, it's a clinical decision. It's based on many things. It's also based on other things that might be on the baby's head. So if we think about some of these scenarios here, I mean, here's a baby with a scalp cannula. Here's a baby who's got a CPAP hat on. We've got phototherapy eye shades. There's so much else going on around the baby. You have to think, how much real estate have I actually got on my baby's head? What is the condition of their skin? And help this guide your decision on which kind of electrode to actually use. I mentioned hair, and the question always comes up, is shaving necessary? Do I need to shave the baby's head? Well, clearly, if you're the picture to the left or the picture to the right with lots and lots and lots of hair, it may be necessary that you have to shave. Ideally, we all want the baby's head to be looking like this, with very little hair, and it certainly makes electrode application much easier. But there's a few tips and tricks that I'll share with you as we go through this presentation on how we can actually manage the hair, and do we really need to think about shaving or not. So let's just talk about the advantages and disadvantages of each of the three electrodes. So I'm going to start with the hydrogel electrodes. The advantages of them, they have very good adhesion when we start to use them. They can appear less invasive, especially to parents if they think there's just something stuck on the baby's head. They're very similar to the EKG, ECG electrodes. We're just sticking electrodes somewhere else. So parents can sometimes be a little more accepting of hydrogel electrodes. And we often, as we're talking to bedside caregivers believe that the concept must be easy to manage. There's no element of fear in handling the baby because it's just something we're sticking on. However, the disadvantages are, as I mentioned earlier, they don't stick forever. Okay, they sometimes don't adhere for long, and they may need either rehydrating, dropping some water underneath, or replacing during the monitoring phase. They are single patient use electrodes or single use electrodes, so they're not reusable. And sometimes, dependent on how well you've prepared the skin and moved the hair, it may be difficult to achieve really good impedance levels with hydrogel electrodes. And also consider the cost. People think that they're more cost effective because per packet they don't seem so expensive. But remember, you potentially may need more than one pack per monitoring session because they may not last forever. So just consider that also. If we move on and think about the cup electrodes, so again, we'll look at the advantages and disadvantages. So cup electrodes, advantages, they're reusable. So we have a box of cup electrodes and we clean them and sterilize them, and we can use them again for the next patient. They are quite easy to reapply, more conductive paste underneath. Again, because it's something stuck on the baby's head, they may appear less invasive to parents. Again, sometimes you get better impedance and you get very good tracing if you really are using the gold cup electrodes. And just for reference, these are the electrodes most frequently used by technicians in EEG labs. So if you needed to troubleshoot anything with cup electrodes, then you can call your EEG technicians, and they're very experienced and likely to be able to help you. But the disadvantages, first of all, they clearly are more expensive because they're reusable. So if they're thrown away, then that can become an expense. We actually have ours labelled with a label on each electrode that says non-disposable, so that people remember not to throw them away. You know, placement and fixation, it's a skill, but honestly, it's a skill that's very easy to learn. And sometimes it's a good idea just to spend some time with the EEG techs and to shadow them maybe for half a day and watch how they actually apply and prepare for EEG cup electrodes. So great idea to visit the EEG lab and technicians for training. Okay, moving on. Needle electrodes. So we call them subdermal needle electrodes. Sometimes we call them low impedance needle electrodes. Advantages, they definitely have the fastest placement and fixation. They're definitely the quickest electrodes to prepare and use and secure and go and be monitoring. There is no need to shave the hair because we're going under the skin, so we haven't got to worry about hair causing any impedance issues. It allows us long-term monitoring very easily, you know, and if they're secured well, we don't need to reinsert them. It gives us long-term perfect impedances. That's why we call them low impedance needles. And they can be very cost effective, particularly if you're purchasing the needles in the single needle packets. If one falls out, you only need to open one single needle packet, and then that makes them super cost effective for you. Disadvantages, you know, they do appear, or they can appear to parents to be highly invasive. Parents are worried about needles in their babies' heads. And obviously it is something that is breaking the skin barrier. So there is a potential risk of infection if they are not inserted under aseptic conditions and covered well. I can only tell you from experience of using needles for like 10 plus years. I think I've seen one example of a local, very localized erythema on a needle. But if you clean the skin well and you cover them well, then there's a really low risk in terms of localized infection. Okay, so I want to launch the second poll question for everybody, and this is before we move into the channels of monitoring. I'd like to understand how many channels of aEEG you guys are monitoring today. So are you using one channel? That means you've got a 3 electrode configuration. Are you using 2 to 3 channels? That means you've got a 5 electrode configuration. Or are you not using aEEG today? And I will share the results with everybody so we can all see. So we can see 17% of people are using the 3 electrode configuration. Most people are using the extra channels. That's great because we get obviously more information when we're monitoring with extra channels. And again, a few people who are not monitoring with aEEG today. Okay, so let's move on and talk about electrode placement just very briefly, because this depends how many channels you want to monitor, depends how many electrodes you will apply. So we know that if we're going to use just the P3 and P4 regions, the biparietal region, that means we've got one channel, okay? Because basically what we're doing is applying an electrode at P3, an electrode at P4, and we're looking at the micro voltage difference between the two sites. That's our EEG. We're looking at the changes in the micro voltage. So in order to have a 3 electrode or cross cerebral electrode placement, it requires 3 electrodes, 2 on the baby's head and 1 ground or reference electrode. and we're placing them in the biparietal region. This is using the 10-20 system for electrode placement. If we want to do 5 electrodes, that gives us the extra channels. So now we're going to place an additional 2 electrodes at the central region, okay? So now we've got electrodes at C3 and C4, P3 and P4. This gives us 3 channels of information because it still gives us the biparietal, P3 to P4, cross-cerebral view. But in addition now, I have the C3P3, so the left side of the brain, and the C4P4 right side of the brain. So this is clearly giving me additional clinical information at the bedside. So I mentioned ground or reference electrodes, excuse me. And this is important. I get a lot of questions that say, well, do we really need the ground or reference electrode? Do we really need to use it? And the answer is yes. And I'm going to try to explain to you briefly why. So let's think about that EEG signal. What is it? So the EEG signal I just mentioned, it's a physiological signal and it's reflecting the fluctuations in potential difference or voltage between 2 electrode sites on the baby's head. And that's the voltage on the cerebral cortex or clearly in the brain over time. And the electric activity that's generated by the neurons at each site, it varies continuously. It's not one standard voltage, it does fluctuate. Now, each EEG measurement is the difference in potential between the active EEG site and the reference site. And all EEG channels are using that same common reference value. So we're going to try to put this into a real life scenario because you guys are probably looking at the picture and thinking, why have we got a ship on the ocean and mountains in the background? So we're going to take this scenario and try to explain how the ground electrode is actually working. So if we take the common reference site as the sea level, so we're going to use this as the 0 value, and then if we take the EEG sites as the mountains or hills in the landscape, and the electric potential as the altitude of the mountains and hills over the sea level. Okay, so that's what we're going to look at. Now, let's imagine the measurement of the altitude and the mountains and hills from a boat navigating on the sea. The 0 value of this ruler here, so the 0 value, must be in accordance with the sea level. That's your 0 level. In order to be able to measure these different altitudes, you've got to have a 0 point to be able to measure your altitudes. So what we're basically doing is projecting up to the top altitude of each mountain profile, and then these measurements are representing the electrical potential of each of the EEG sites. Okay, so that's basically as simple as it is. This is EEG electrical potential, and this is my ground or common at the bottom here. Now, why have I got a boat on the ocean? Well, what we've got to remember in our environments is we get noise, okay? Electrical noise, physiological noise, movement, etc. And that's represented by the boat on the sea. That kind of goes up and down a little bit because, you know, noise, it changes quickly over time and it can affect measurements, right? So if my boat is going up and down, it's going to affect the measurement of the EEG or the mountain altitude and the EEG potential, because as the waves move and you get a disturbance, it will affect all of those measurements. So in order to remove the disturbance, sorry, I went forward too quickly. In order to remove the disturbance, what we're going to do is have that kind of 0 point. What we want to do is kind of anchor this boat, make it the 0 point, reduce the noise as much as possible, and then we've got our common reference point and then our active EEG sites, the altitude of the mountains and the hills. So the ground site, the harbour where the boat is actually anchored, will reduce the disturbances in measurements. So in answer to the question that we get asked a lot, yes, the ground and reference electrode is very important, as is preparation of the skin of the site of ground and reference electrodes. So it's very important to also prepare the skin on those ground and reference electrodes. But I will ask poll question number 4, which is, how confident are you with the application and management of your electrodes? So thinking about those of you who are using electrodes today, how confident are you in that process? So let's launch that poll. And let's see what people say. You can use the emojis if you want to. 19% of people feel very confident that they're easy to apply and manage. That's fantastic. 45% quite confident. 28% unsure, struggling with impedance, and 9% of people very uncomfortable. So let's hope by the end of the session that we can help the people who are unsure and uncomfortable to feel better about electrode management. Okay, so let's move on. The first thing I'm going to cover then is the procedure and the application and the preparation with hydrogel electrodes. Now, the one thing to remember, particularly with hydrogel electrodes and cup electrodes, skin preparation is the most essential component. Taking your time to prepare the skin, to remove any debris, oil, move the hair, is the most crucial element to successful electrode application. So the next few slides are going to discuss hydrogel electrode infant preparation, and then we'll go on and we'll cover needles and we'll cover cup electrodes. So the first thing we need for hydrogel electrode application is your supplies. So you're clearly going to need your hydrogel electrodes. You're going to need something to clean the skin. This is New Prep. It's a skin preparation gel. It's slightly abrasive. You're going to need an electrode positioning aid. This helps you to determine where those electrodes are going to sit on the baby's head. You're going to need some kind of cleansing agent, saline or water, some cotton swabs to clean the skin with, a skin marker to mark where you're going to place the electrodes. And if your baby has got an abundance of hair, then maybe you're going to need a comb, or my tip and trick is a toothbrush. And when I change the video cameras shortly, I'll show you exactly what we mean by that. Because a toothbrush makes a really great baby hairbrush, especially when it's dipped in water. So the other thing just to mention, optionally, you can choose to use a wrap hat. I'll show you how these work just now, and that will help to protect the electrodes as well. If you're only using the 3 electrode configuration, then the remaining 2 electrodes that would be left can be stored in the resealable pouch, and then you've got them there for future use if you want to. But regardless of whether you're using 3 electrodes or 5 electrodes, the following steps that we're going to go through related to the positioning aid and preparation are relevant. So the first thing is the positioning aid, because we want to find that C3P3 and C4P4 marks on the baby's head. So we have our positioning aids, and our positioning aids are utilising 2 anatomical landmarks. And the positioning aids, and you can see them here on the screen, they actually have the marks on their sagittal suture and ear tragus. Okay, so we've got the ear tragus at the bottom and the sagittal suture mark at the top. Now, what we want to do is line up the positioning aid across the baby's head So the ear tragus is next to the ear tragus, which is that small cartilage piece at the front of the ear, and the sagittal suture points are at the sagittal suture, the middle part of the baby's head. So we're going to first line up by positioning the aid over the ear, parallel to the face, and the ear tragus should touch the anterior edge of the positioning aid. Okay, that's very important. We're then going to move the aid backwards and forwards a little bit. We're going to identify the sagittal suture, and we're going to slide the positioning aid backwards and forwards until the letter of the alphabet, or the symbol, if that works better for you, is the same at the ear tragus as it is at the sagittal suture. And this letter is going to vary dependent on the head circumference of the baby. It's not one letter fits all. It really does vary per infant. Okay. Then, once we've got it in position, we're going to take a surgical marker and we're going to mark the front and the back of this arrow. Okay, because this is where our electrodes are going to sit. So if you're using the 5 electrode configuration, bilateral configuration, use your surgical marker and mark at the front and back of the arrow. And that's going to be on the left side, C3 and P3, and on the right side, it's going to be C4 and P4. If you're using the 3 electrode configuration, then simply omit the anterior side and only mark the posterior side of the arrow. Okay, so you want to make sure that you've got your positioning marked. The next thing we need to do is to part the hair and prepare the skin. Now, if your baby has got a lot of hair, like this model on the screen here, this is where you're going to need your toothbrush dipped in water to kind of brush it apart, or your comb to part the hair and move it out, so that you've really got, you can see the skin underneath. So if your baby has got an abundance of hair, that's the first thing to do. The next thing you're going to do is take a small piece of new prep, like you can see here, put it on a cotton tip, and work it up and down that exposed piece of scalp. And I usually go up and down 5 times. So I go 1, 2, 3, 4, 5. Make sure that and use a reasonable amount of pressure to make sure that you really have cleaned that skin well. And I would recommend to hold the skin taut, stretch the skin whilst you're doing that. Once you've cleaned it with the new prep, it's very important to remove that new prep. Okay, so take a damp gauze pad and, working from the center or outwards from the center to keep the hair parted, wash that new prep off. Okay, very important. Then we're going to take our hydrogel electrodes and we're going to peel them off the card, and we're very simply going to apply the sensors directly over those clean sites, preferentially with the sensor lead facing upwards, and we'll repeat those steps for each of the individual sensors. I would highly recommend that you prepare one site at a time. So prepare it, clean it, wash it, place the electrode. Then prepare, clean, wash and place the second electrode. Don't try to prepare all 4 sites at once. I would highly recommend to do them one at a time. Once you've got all of your electrodes in place, they should resemble these pictures. So on the left, you've got the 3 electrode configuration because you've got 2 electrodes on the head and you'll have 1 ground or reference. And the picture on the right, we've got 4 electrodes on the head and 1 as the ground or reference. So talking about the ground or reference, you need to select a site either on the back or the shoulder, or sometimes it works as well just to take a place behind the ear. That's a very good place to place a ground electrode, but choose a site that's got minimal hair. So if you've got a baby with a huge amount of lanugo over their shoulders, then again, use that behind the ear placement or potentially the chest. So we're going to do exactly the same thing, preparing the skin. We're going to prepare the site of the ground electrode by placing a small amount of new prep or other agent, whatever cleansing agent you're using, on a gauze pad, and we're going to clean the skin, wipe it perhaps in a circular motion, remove the new prep with clean damp gauze, allow the site to air dry, and then place the hydrogel electrode on that clean site, again with the lead facing upwards. Okay. We then want to make sure that they're very secure. So we would, whilst a wrap hat, it's not imperative, you don't have to use them. They really are very helpful to protect the electrodes from being dislodged. It's totally your choice if you want to use a wrap hat or other kind of securing measurement. If the baby's on CPAP, then often the CPAP hats can double up and be used as some kind of securing mechanism for the electrodes in place. So we're going to carefully gather all our wires together. And then we create what I call a strain relief loop. You see there's a small piece of tape here. It's taped the electrodes together, and I can secure this now to the bed. The reason for the strain relief loop is it can really help prevent any dislodging. So imagine I've got this actually clipped or taped to the bed. If somebody pulls at the distal end, it's going to pull my strain relief loop and it's not going to pull the electrodes. So this is a really good tip and trick to prevent electrodes from being pulled and dislodged. Just a few hints and tips in terms of skin preparation tips for hydrogels. So, you know, always remember hydrogel, it's a water-based agent. It becomes more adhesive with heat. So allow the hydrogel electrodes to warm up a little, perhaps place them in the warmer or incubator if you have that available, whilst you're prepping the skin. Like I mentioned, it's highly recommended you prep one site at a time, place one electrode at a time. Always apply the skin prep gel directly to the skin, not to the electrode. Always remove the skin prep from the skin. Don't put it on the electrode, it's going to increase the impedance. And then once you've got that electrode in position, run your finger around the edges of the electrode for kind of 20 or 30 seconds, just to warm that electrode and ensure that you've got a good seal, and then potentially use a hat to secure the electrodes in place. In terms of troubleshooting with hydrogels, you know, definitely if you've got an impedance of greater than 20 kiloohms, if you're using the Olympic Brains monitor, you're going to get a signal alert. And the really nice thing about the signal alert is it will actually tell you which electrode has the problem. Here we can see it's actually C3 that has the impedance issue. The impedance on the other electrodes is actually fine. So if we get that situation, we're going to check that sensor all the way from the skin all the way back to the data acquisition box. We're going to make sure all of the electrodes are properly connected to the data acquisition box. If an electrode is lifting, try to attempt to rehydrate it. Use some water to rehydrate it. And notice I mentioned water. I would request people not to use saline for rehydration. If you're using saline and you're really soaking the electrodes and the head, that can cause an ion channel. So think about what sodium is. It's got those positive ions, which are great electricity conductors. So if you've caused this sodium ion channel on the baby's head, you can actually make the aEEG trace appear flat, because all that's happening is the electricity is conducting from one point to another. It looks like there's no activity because it's all being conducted around that sodium ion channel. Okay, so do use water for rehydration. If you're going to do that, just lift it slightly, put some water underneath, use a finger to tap it, reapply it. You may need to re-prep the skin, you may need to put a fresh electrode on, And don't forget that the ground or reference electrode can also fail. You may need to re-prep, rehydrate your ground electrode, and think about replacing it every 24 to 48 hours. Okay, so what I'm going to do is I'm going to try to change my webcam, and I'm going to try to do something very practical on the desk with you guys. So I'm going to stop the actual slideshow screen share so that hopefully you should see the desk camera in a bigger view. So here you have my baby. She's actually wearing hydrogel electrodes at this point in time. Now, we talked about the positioning aid. The positioning aid comes in two different sizes. So the bigger size is the size that we would use for the full-term babies, and the smaller size is the one that we would use for the smaller head circumferences or preterm babies. Just noticing that my camera is slightly out of focus there, so I'll try to make that a little bit better for you. Okay, so again, I'll practically show you how this positioning aid works. So I'm going to do one side at a time. Again, remember, we're going to locate our landmarks, the ear tragus and the sagittal suture down the middle of the baby's head. So I'm going to take my positioning aid, and the bit that says ear tragus, I'm going to put parallel and directly align there. And then I'm going to bring the positioning aid up and over the top of the baby's head. Okay, so you can see that my ear tragus is there. I've got this running up and over the top of the baby's head. And what I want to do here is I want to slide this backwards and forwards until the same letter of the alphabet sits at the sagittal suture and the ear tragus. Now, I know from experience that on this baby, that happens to be the letter D because I've measured her a fair few times. So here I can see I've got the letter D at my ear tragus, and I've also got the letter D sitting at my sagittal suture. If it was a baby with a smaller head, or a bigger head even, it may be that it's a different letter because you're going to have a bigger head circumference. But for this specific baby, it's actually going to be the letter D. And hopefully, I'm hoping you can see that the arrow either side, I would take my surgical marker and I would mark the arrow on either side, and that is exactly where I'm going to place my electrodes. And you can clearly see that I actually have got my electrodes in that position. Now, we talked about the skin preparation. So skin prep is very important. So skin prep is going to, just bear with me a minute, skin prep is going to remove any dead skin off the baby's skin. So we use New Prep. It's a really great skin cleansing agent. Like I mentioned, you can take a small piece of New Prep on a cotton tip. Another trick, and sometimes this makes it easier in practice, if you've got your gloves on, which you probably will have on, just place a small piece of New Prep on the back of your hand, on your gloved hand, and then you can take the New Prep from there and use it to prepare the baby's skin. Okay, so like I said, you're going to part the hair. This is actually where my toothbrush comes into action. Excuse me, because like I mentioned, if you've got a baby with a lot of hair, you can use a toothbrush very nicely to part the hair, dip your toothbrush in some water, and then brush the hair from side to side so that you get a direct parting, and it'll be through that parting that you actually clean and prepare the skin. Okay, so we talked about preparing the skin. We're going to get the electrodes in position. We're going to run a finger around or even the heel of a hand to warm them. We mentioned about rehydrating. If you need to rehydrate, if they're coming up, then you can simply lift the edge again, perhaps use a cotton tip soaked in water and rehydrate around the edges, and again run your fingers round to make sure that these electrodes get secured back down. Now the ground or reference electrode, now clearly if I had a proper real baby here, I wouldn't be turning her face down into the prone position like this, but hopefully you all appreciate this is for demonstration purpose only. You can see that I've got my ground or reference electrode on the back of the baby's shoulder, but like we mentioned, you can put it here behind the ear, or you can put it onto the front of the chest. But you'll notice that I've got my lead trailing upwards, and that I've got all of my head electrode leads trailing upwards. So this just makes electrode management much easier because all of my electrodes are facing in one specific position. So I hope that's helped to briefly go through the hydrogel electrode situation, and we'll move forwards to needle electrodes. So the supplies are slightly different with our needle electrodes. So with needle electrodes, we're clearly now going to need something to clean the skin. So in this case, you can use, again, whatever it is that your local facility advocates for skin cleansing. It could be alcohol, it could be iodine. You know, generally people will use whatever it is that you use to prepare for an IV insertion. So get your cleansing agents ready, get your low impedance needles ready, something to secure the electrodes, some tape. Some people will use Tegaderm. I'll give you another couple of tips as we go through. Again, your wrap hats, your positioning aid, but you are still going to need hydrogel electrodes and new prep, because the ground or reference electrode, even when you're using low impedance needles, will always be hydrogel. Okay, we will not be using a needle as the ground or reference electrode. So again, wrap hats are included as an option if your facility wishes to use them. Just check your local guidance regarding wrap hats and needle electrode safety. Some people don't use wraps when they have needles in place. So again, just please check what's locally applicable to you. So the needles that you see here, they're packaged as single needles. I'll show you in just a moment. They come in a box of 24 and they come in different colors. So you can choose one color for the front of the head, one color for the back of the head. Again, remember, hydrogel electrodes are in a packet of 5. You use the one and then you reseal the packet for future use. Okay, so that's your supplies. You're going to do the electrode positioning in exactly the same way. So you've got your positioning aid, but you can mark your sites with your surgical marker again if you want to, and then clean with your alcohol. If you're using iodine, then you can actually mark the site with the iodine. It will, show you exactly where you're going to insert those needles. So same preparation with the positioning aid, and then we're going to insert the needle. And again, I'm going to show you how to do this in just a moment on camera. So with subdermal needle insertion, whilst you're holding the skin slightly taut, just like you would do for an IV insertion, you're going to insert the impedance needle subdermally all the way up to the hub. We want the needle all the way in. And then we're going to secure it with tape in a kind of chevron or pant leg style, or you can cover it with Tegaderm or something like Mefix. Whatever it is you choose is your best option for covering needle electrodes. Again, you can insert the needles in any order. Okay, so it doesn't matter whether you do left first, right first, front first, you can insert them in any order. But again, clean that site and insert them one at a time. So once we've got them secured, we'll use tape to secure. I'll give you, I said, another couple of tips and tricks on how to do this in just a minute. So we want to really make sure, as I say, sometimes I use steri strips, which I'll demonstrate. Really make sure that these electrodes are well secured. Some clinicians actually find it quite helpful to part the hair and mat the hair down with some kind of water-soluble lubricant or preparation like skin prep, skin tack. You can put this on the hair and mat the hair down, and then that helps you with applying the adhesive paste or adhesive tape, I'm sorry, or Tegaderm, whatever it is that you're choosing to actually use. Once you've got all of your needles in place, they should resemble these pictures. This is the 3 electrode configuration. This is the 5 electrode configuration. And we're going to do exactly the same in preparing the site and placing the ground electrode. We're going to clean the site, wash the new prep off, apply the electrode with the lead facing upwards. We're going to secure the electrode, same thing, create a strain relief loop. Again, we mentioned wrap hats, not imperative. They can protect the electrodes from being dislodged. But again, it is totally up to your local discretion based on your own local policies and procedures regarding needle safety. So make your strain relief loop to help prevent dislodging if the electrode gets pulled at this distal end. Just a few tips in terms of skin prep. So like I said, hold that skin taut prior to insertion. The important to remember, the direction of the needles is not, is optional. It's not mandatory which way you put them. You can put them anterior to posterior, posterior to anterior. The important thing to remember is to put them all in the same direction, because what we don't want is for the needles to touch. Because if the needles touch under the skin, you'll have exactly the same scenario as the sodium ion channel. The electricity will just conduct between one point and another, and you'll get a flat trace on your aEEG. So it doesn't matter which way you place the electrodes, just put them all in the same way. Think about the state of the infant and the amount of handling required really as to when you're placing them. For troubleshooting, again, you should not see impedance of greater than 20 kiloohms. You'll get your alert on the monitor. If you do, then again, check that needle. It hasn't come out, it hasn't been dislodged, it's properly connected to the data acquisition box. That the data acquisition box is properly connected to the monitor. And if you do find your electrode is dislodged, then get a new electrode. We never reinsert a needle that's fallen out. So we're going to clean a new site, insert a new electrode and resecure it with tape or other adhesive. And again, don't forget about the ground electrode. Don't forget that can fail. If you think you've got issues, then you may need to re-prep and re-prepare your ground electrode site. So before we move on to cup electrodes, I'll do the same thing, and I'm just going to swap the camera again for a moment, and we'll just take a quick look at these needle electrodes and see what we can see with them. So needle electrodes, like I mentioned, they come in single packets. So you would get a box of kind of 24. And you would have all sorts of different colours in there. I'm going to stop sharing my screen. So I have my packets. I would just open the packet and I would take out the individual needle. Now you can see that it's got a small sheath on top, and I'm going to need to remove the sheath when I'm ready to insert. Now clearly this baby has a plastic head, and I'm not going to be able to get a needle into her. So for the sake of demonstration, and this is a very good tip and trick I would highly recommend everybody to use in training people to do this. And I have 2 pieces of fruit. You can choose an apple, an orange, a grapefruit, anything that has skin that you can insert a needle into. Now, because I fancy eating the orange after we've talked, I'm going to choose the apple. And I'm going to presume the apple is my baby's head. So I will presume I've done my measuring. I will take my alcohol swab. I will clean the baby's skin. Let's choose a place where I think you'll see the needle. I'll clean the baby's skin. I will take off my protective herb. And then what I generally do is go in, I'm trying to do this at the right angle for you on the camera. I go in at a 45-degree angle until I've just pierced the skin. Then I flatten, and then I place the needle all the way in to the hub. Okay, so you can actually see that needle under the skin. It is in the skin, it's under the skin, okay, but it's in all the way up to the hub. So the next thing I'm going to do is secure it. Now, remember I mentioned you can use tape, so I've actually got a roll of tape here. I could use tape if I wanted to, but I have to say my personal preference is steri strips, because steri strips are very sticky and they're very small as well. So I simply take my steri strip, place it underneath the needle, and in a chevron kind of style, I secure that needle electrode. So I've actually got that steri strip taped around the hub. Can you see there? Taped around the hub. And it's stuck really nicely and firmly. So I can give this a really good pull now. And that's quite significant pulling from my end. And you can see that that needle is quite well secured in there. And I can see it's beautifully just underneath the skin. So I'll do that to all 4 electrode sites. And then once I've done that, I'll do the same thing with my ground or reference electrode and make sure that I've got that placed directly on there. But again, I'm going to show you actually very shortly a video of actually doing this on a real baby so that you can see exactly what this looks like. So let's go back and talk about the cup electrodes. So with cup electrodes, again, it's pretty similar preparation supplies. Now we've got the cup electrodes, potentially still hydrogels you may want to use as your ground or reference, your positioning aids. The addition we have here now is conductive paste. So we needed an extra paste to act as the conductive measurement with cup electrodes. Excuse me. So exactly the same positioning as we're using with hydrogels and needles, and the skin preparation is exactly the same as with hydrogels. The main difference with the cup electrodes is that requirement for the conductive paste. So like we said, we're going to use the positioning aid and go backwards and forwards. And we're going to, I'm just going to change the baby for the next bit. We're then going to, again, take the new prep and the conductive paste. Remember I said I actually place that on my gloved hand. I find that very helpful so that when my hand is in with the baby, I've got the paste and the new prep already on the back of my glove, and I can just scoop it with a cotton tip or with the cup electrode. So I'm going to clean the skin as we see here, and then I'm going to take a blob of my 1020 paste and I'm going to place it in each of the points I've marked as to where my electrodes are going. So now that's signifying to me, right, this is where I'm going to put that, that specific cup electrode. The next thing I'm going to do, take a cup electrode and I'm going to fill it with paste. And I say to people, imagine it's an ice cream scoop. Imagine you've got that electrode and you're scooping ice cream and you want a nice full cone of ice cream. So you want a nice full cup of 1020 paste. And once it's full, then I'm going to place it onto each of the points that we've identified, and I'm going to place it down. And then I'm going to take a piece of tape that I've already pre-prepared, and I usually have them stuck around my paste pot ready to just put on and secure them directly in place. Okay, so it's just little, call them postage stamp size pieces of tape to secure the electrodes. So same thing, we can use a wrap hat. We're going to create the strain relief loop. We're going to plug the electrodes into the data acquisition box. A few tips and tricks again. Remember, I would recommend you prep and place one electrode at a time. Always, again, apply the skin prep gel directly to the skin. And always make sure that the 1020 paste has filled the cup before you place it. Use a small piece of tape to make sure that you secured the electrodes in position. Use a hat to hold the electrodes into place. That really helps. And then thinking about troubleshooting, very similar to hydrogel electrodes. Make sure you've checked that electrode all the way from the skin back to the box. Make sure the box is plugged in properly to the monitor. If you see an electrode moving or lifting off, attempt to repaste it and reapply. You may need to remove that electrode and re-prep the skin surface, reapply the 1020 paste and re-secure that electrode down. And again, do not forget that the ground or reference can fail and that might need replacing every 24 to 48 hours. Okay, so what I'm going to do, same thing again, I'm just going to switch the webcam for a moment. I'm going to stop sharing my other screen. And I'm going to, you'll see the baby disappeared. That's because she got replaced with a different one that actually has no electrodes on her head at all right now. So now, this time I'm going to remove my EEG electrodes out the way, and I'm going to have my cup electrodes in place. I'll have my positioning aid, I'll still have my new prep, my skin marker, I'll have my toothbrush if I need to, and my water to prepare to move to part the skin. Again, remember I said I would put some new prep on my hand, so I'll actually do that. Put some new prep. And then I also, as I mentioned, take a decent amount of 1020 paste and put this on my hand as well. So I'm going to get a great big blob of 1020 paste and put that on my hand also. I'll just put my lid back on to make sure that it's nice and clean. Okay, so what we're going to do, we're going to take the new prep on the cotton tip. We're going to clean, remember, backwards, forwards, backwards, forwards. We're going to take a piece of gauze in some water and wipe that new prep off the site. Then I'm going to take a small piece of my 1020 paste. I'm going to put it in that place because that's the place I've just cleaned. Okay, I'm going to take my EEG cup electrode. I'm going to scoop, watch this, so here's my electrode. It's got, you can see, a divot inside it. I'm going to scoop a big bit of paste until my cup is really full of paste. And then I'm going to place it gently but firmly down onto that site. Okay, and I often just then take some of that paste and use it to secure that electrode a little bit more in place. Then remember I said I'd already prepared my tape. It's sitting on the outside of my pot. To take my piece of tape and I'm going to place it over the top of the cup electrode. Remember, you could use skin tack on the hair, skin prep on the hair to mat it down if you needed to. But you can see that my electrode is very nicely positioned in place there. So extra step with gold cups is the use of the 1020 paste. So my way of doing it, it's not everybody's way, but I like to have it on the back of my hand. I just find it easier to have everything with me when I'm actually in and preparing electrodes inside the incubator. Okay, so what I'm going to do now is I'm going to share with you guys, I'm going to stop sharing my webcam for a minute, and I'm going to share with you guys a video that is going to run through each of these steps one by one. So this is just 2 minutes of video.
Next, collect 2 electrodes for a single channel amplitude integrated EEG, or aEEG, and 4 electrodes for a 2-channel aEEG. If not using needle electrodes, choose the type of electrodes you want to use instead. Prepare a positioning strip, skin disinfectant, tape appropriate for use in neonates, swabs, skin preparation gel, a module box, and contact gel for gold cups. Apply the electrodes during routine care by first disinfecting the skin. Then place skin preparation gel on a cotton swab until it is moist. Apply a few gentle strokes with the cotton swab, using very little pressure. Then place the reference electrode on the back or the chest of the infant. After the reference electrode has been placed, Put the measuring device on the infant's head and line up the same signs on the infant's tragus and sagittal suture. Then, right before placing the remaining electrodes on the infant's head, disinfect the area indicated by the arrows on the measuring device. When using needle electrodes, stretch the skin slightly and insert the needle tangentially, just underneath the skin at the markings, with the tip of the needle pointing in the caudal direction. Use tape to keep the electrode in place. Next, insert the cables into the module box as indicated by the legend on the box. If the impedance of the reference electrode, gold cups, or hydrogel electrodes is not satisfactory, perform a few strokes with the cotton swab under the corresponding electrode. If using gold cups, fill each cup with contact gel. Place the cup in the proper position with the cable running towards the head end. Tape it into place. Alternatively, if using hydrogel electrodes, place the electrodes with the cable running towards the head end. Ensure that all electrodes are in place and that there is no mechanical contact between electrodes.
So I think it's nice just to see it in real time, to actually see exactly what it is in real life practice that we're trying to achieve here and do. Okay, so we'll move on. We're nearly at the end now. I appreciate we've perhaps run a little bit over time. So what we're going to do next, once we've applied all these electrodes, we need to connect them, right? And this again can be where a bit of troubleshooting needs to come in. Just make sure you use the head graphic that you see on a data acquisition box to connect the sensors into the most appropriate port. So the left anterior sensor goes into C3, the left posterior sensor goes into P3, etc., etc. And dependent on how many electrodes you've got will depend on how many you plug in. So for a single channel configuration, you've just got 3 plugged into the box. In a 2 to 3 channel configuration, you've got the 5 plugged into the box. Next thing we're going to do is check the signal quality. And this will appear on the monitor for you. It'll do a data acquisition box check. It'll check your signal quality once you've clicked start recording. And you'll see the impedance display will display impedance for you. Okay, if it's green, it's all good. You see your impedance values per electrode at the top here. You see the bottom one here, we have an issue. This is clearly the front left electrode, the C3 electrode, that needs some attention. The next thing we do is we enter the patient information. We click record. We enter the patient information using the on-screen keyboard as we need to. We then select which electrode configuration we have, 3 or 5 leads, and we click start recording. And we're good to go. Now, again, just want to mention about troubleshooting impedance, and I want to talk about the ground or reference electrode again. So when we think about impedance troubleshooting, one thing that we commonly overlook is the failure of that ground electrode, the hydrogel ground electrode. And a failing ground will present high impedance in the active electrodes, even when they're still good, they're still intact and receiving a good signal. And sometimes what we see at this point with a failing ground electrode or any failing electrode is this kind of thick, fuzzy appearance to the raw EEG. So the picture on the right is what you might see when you've got failing electrodes. And if you leave this unattended, you may get an artificial elevation, which could change the positioning of the aEEG on the graph and possibly lead to misinterpretation. So if you see something looking like this, you need to pay attention to your electrodes and do not forget the ground electrode. Okay, so 2 final polling questions. Polling question number 5. So the question is, after listening to this information, which kind of electrodes do you think you would choose to use after listening to the presentation? Do you think you would choose to use needles, cups, or hydrogel electrodes? more people want to actually use subdermal needles, less people want to use hydrogels than we're using them at the very beginning. That's great news. And more people want to use cup electrodes, which is also great news. Okay, so I'll hide that poll, and we have a final poll question. You know, after listening to this information, has it been helpful? I think is the most important thing. Now, how do you feel about electrode placement and management? So again, I'll launch this poll. So now only 3% of people feel unsure, 16% feel okay, and 81% of you feel much more confident. So that's fantastic news, and hopefully this session has been really helpful in helping you understand that more. And hopefully you see something that looks like the Olympic Brains monitor screen, and that's because it is the Olympic Brains monitor screen. So let's imagine I've applied my electrodes, and I'm now going to hit start recording. We are going to see that it's going to ask me to enter patient information. So let's enter the patient ID, not very original ID, and last name is Baby, and first name, let's just call him New Baby. I can add in the date of birth if I want to. So I think I will do that. Let's say the baby was born yesterday, and I'll click next. Next, it asks me which configuration am I going to use. I am definitely going to use the 5-lead bilateral configuration. I want that extra information, and I simply hit start recording. And when I hit start recording, you'll notice at the top it's doing a data acquisition box self-test, and it's telling me my signal is green. It's telling me I've got good impedance. Okay, that's very important. So when I look at my impedance view, it's actually still gathering the data at the moment. I haven't got a green box here yet, so it's not in live mode. But once I am in live mode, my impedance view, you can see here, my impedance view is showing me that all of my electrodes are good. Now, if I go to my EEG view, I can see I haven't got that thick fuzzy trace. I've got a nice EEG trace going here. Let's look at the extra channels. They both look good. My little digital pen is running up and down at the side beautifully. So I know that I'm recording. I've got a good signal and I've got no clinical alerts. Okay, so that's proving to me the electrode application was good. Everything is good. My impedance is good, and I have no alarms. Okay, so on that note, we have come to the end of the session. I'm sorry we did run over. It's quite a lot of information to go through. But Suzanne, I'm going to ask, do we have any questions?
We do, Judy, and thanks so much for that excellent presentation. One of the questions that we have here is, what is a good impedance level with the gold cup electrodes?
Okay, we ideally want to aim for an impedance of less than 10 kilo ohms. Okay, so anything less than 10 is going to give us a green signal, like we saw on the screen just then. Anything between 10 and 20 is going to give us an amber warning signal. And anything above 20 is going to give us a red impedance, no good, please help and replace me signal.
Okay, great. So basically the same with the hydrogel electrodes.
Absolutely, yeah.
And other electrodes as well. And moving on to the next, can the reference electrode be placed over the forehead instead of the back or the neck?
Okay, we always used to use, when we use the old, very old style, no longer available CFM 6000 monitors, people will remember that we actually had frontal placement of the electrodes, yeah, and we would use the front of the head as the ground or reference electrode. Now, if you think about the front of the head, I don't know how well you can see mine, but with age, I get a lot more lines and a lot more movement in my forehead. As I'm moving about, yeah, so that could actually disturb the ground or reference electrode. By choosing the shoulder behind the ear, you really don't get that movement like you would get on the forehead that could disturb the ground electrode. So we do recommend shoulder, chest, behind the ear.
Great. Thanks for that. Moving on to the next. What is the reason for needing to clean any excess new prep away after prepping the skin? Is it because the new prep will prevent the electrode from adhering, or because it can affect the impedance?
Because it affects the impedance. Okay.
Yeah.
So new prep, for any ladies who are on the call today, new prep is just a bit like a facial skin abrasive. I'm rubbing it on my finger. It's like got a sandy, gritty texture to it. So just like we prep our skin and we use facial scrubs because we want to remove dead skin and oil and everything off our skin, it's exactly what we're doing with preparing with new prep. But if we leave that new prep on there, that gritty substance can cause issues with impedance. So please remember, new prep is skin prep gel. It is not conductive paste. Please wash it off.
I think you've probably touched on this one. Your impedance is, if your impedance is poor for the ground electrode, will that show up on the brain's monitor? And you did talk to that point.
Yeah. So if you start to see that thick fuzzy line on your EEG, it could be that it's your ground or reference electrode that's failing.
Thank you. And another question here, and I get asked this as well. Some centers use the conductive paste with hydrogel electrodes. Would you consider this to be a problem?
It's not a problem. Some people do. Absolutely. So the 1020 conductive paste, which I know with the virtual background doesn't look very good, but yeah, you can take a very thin layer of this. Some people will use this underneath hydrogel electrodes, but again, you will have prepped the skin with new prep first. You will have washed the new prep off. You will have moved the hair, and then a very thin layer of conductive paste some people will use underneath hydrogels if they're struggling with, getting a good signal.
Okay. And Judy, when you were going over inserting the needles and how you were prepping the skin, when you're inserting the needle, are you inserting it right at the dot or right where the surgical pen dot is, or in the center of the
I'm putting it right. So if I've made a mark with my surgical pen, that's where I'm actually aiming to kind of, I mean, maybe just a little bit before that and get the needle in. So the needle is sitting underneath exactly where that dot is.
Okay, thank you. Why do we not use the new prep on the needle application? And I think you've covered that.
Yeah. I mean, it's quite simple. Needles are sitting under the skin. We don't need to worry about moving oil, debris, meconium, blood, vernix, whatever it is that's on the baby's head. Because the needles are going directly under the skin, we don't need to prep the skin except for the cleansing agent.
Okay, thank you. If the baby has edema on one side of the head, how would you place the electrodes?
That's a great question. I was waiting for the Keffel hematoma or edema question. Okay, so, it's always challenging, isn't it, if we have a baby who has a huge Keffel hematoma or, a really edematous patch on their head. And what I would recommend, particularly a Keffel hematoma, we're not going to put the electrodes over or in where a Keffel hematoma is, because that collection of broken blood cells is just going to impede the signal. So we would go either side, just a little bit further back and a little bit further forward from the side of that edematous or bruised area on the baby's head. Which brings me to a really good point, and I did mean to kind of mention this earlier. Artifacts themselves, and I call Keffel hematoma and edema a potential cause of an artifact, are something that we need to learn to manage. And an artifact session is a completely different session on its own. So if anybody wants to know more about that kind of thing and more about artifacts and how to manage them, then please do go to the Neonatal Care Academy and go to the online courses. You see online courses here, and in online courses you'll find a best practice for electrode preparation, but you will also find a great course called Artifacts and Pitfalls in aEEG. So this is by one of our key opinion leaders, Dr. Carl Scheckler. He does an excellent talk and talks through all of the artifacts and things like cephalhematoma and edema, etc., that might cause issues with the aEEG and with electrode placement.
Do you have any recommendations on trying to prevent any needle sticks when removing the needles?
Yeah. Where's my baby? Let me take my piece of fruit. Let me swap the camera again. And let's just take an example of removing the electrodes. So swap the camera. I have got my Pantelectra, my chevron staked, and potentially maybe as well, I probably have put a piece of tape over the top of that also. Okay. When I go to remove the electrodes, clearly I will have my gloves on, number one, but I've taken them off. But I will peel back that tape and I will peel back the steri strip till I've got just the herb of the needle kind of there. So you can see my tape is pulled back. Well, you can see because the sun is shining, which is most unusual for the UK. Okay, I've pulled it back. So I can now, from this end, remove the needle, okay? And imagining, we have to use a bit of imagination here. This is the baby's bed now. I place it down on the baby's bed and stick the tape over it, okay? Then I take the whole electrode and remove it. Another option some people will do is take it out, have a small pot, have a pair of scissors, and again you will have disconnected from the data acquisition box, you will have unplugged them. So long as they are unplugged, I know some people who will do that. Cut the end off into a pot, and that should remove any potential for needle stick injuries, if that helps.
Okay, Judy, thanks so much. And I think for the sake of time here, we're going to close our session or end our session today. So on behalf of Natus Medical Incorporated, we would like to express our sincere appreciation to you, Judy, for your outstanding presentation and contributing to our educational resources on the Neonatal Care Academy.
Thanks so much, Suzanne. Bye, everyone. Stay safe.
Bye-bye.